Hello, my name is Heather Rodriquez. I am the Chief Nursing Officer for Community Medical Centers. To say these are unprecedented times is an understatement. Our hospital system has faced a number of challenges over the past few months as we continue to battle the coronavirus pandemic. But it's the everlasting commitment to care that our staff embodies that keeps us pushing forward. I am so proud to work with a team of individuals that is strong, passionate, and willing to face challenges head on. And it is the encouragement and support of our community that keeps our staff pushing forward. Our entire team is so incredibly committed to keeping our community healthy. So for this week's State of the COVID Crisis, we would like to share some stories that may truly resonate and touch your heart.
I have actually been here 14 years. I've been a nurse for 25. To say this is unprecedented is probably an understatement of the year. So I never dreamed of a pandemic. Even when we had swine flu, it wasn't on my radar. Not like this. This is unfathomable. There have been a few tears. You know, I'm a hugger personally. I'm used to hugging, and when patients turn into family, we hug each other. A lot of our patients are dealing with an end-stage illness. Heart failure is end stage, and they need the emotional support to get through this. So I had to admit an 85-year-old gentleman who normally is with his wife or his daughters 24/7. He didn't even know how to dial the phone to call home. And so I had to do a lot of reassuring and telling the family that he would be okay, that we would be there for him, that we would show him how to pick up the phone, or we would do it for him. And for me personally, that was very hard. He had become like family for me. You know, we're all living in difficult times, and we have to give each other a little grace during these difficult moments. And I've appreciated actually the grace that my patients have given us, because it's been a harder challenge for us as well.
Being down here in the ED, among other departments, I'm sure, but we have to be very adaptable, very flexible. Things are constantly changing around here, so you know, we have to adapt very well to our surroundings, and constantly things are changing. During this time, I feel like it's been pretty difficult as far as the whole pandemic. More difficult than the usual difficult. I don't get to spend much time with the family due to the conditions and not trying to put people at risk. But that, and in addition to being, there for my staff and amongst each other, we're here like a family, and so that really heavily helps us get through the day. Being a little bit more sensitive and compassionate with the patients, in addition to the staff, has helped us to get through it a little bit better. Especially with the no visitor policy, patients aren't able to have those family members to rely on while they're here, and so I feel like it's very vital that we're there for them, not only just on the medical aspect of it, but also emotionally. I just want to say, that I'm blessed to be working for a community, and that I'm really proud of the staff, all my coworkers, everybody through the hospital, including, those that sometimes get overlooked. They all come together, we all make a team. We're a vital link in the chain of success, and we all have a role to play. So I just want to say thank you for everybody that's dealing with this, and that I'm proud to be a member here.
I've been a registered nurse for 20 years, and I would have never believed that we would be 4 months into a pandemic and have so many of our day-to-day freedoms and with restrictions in place. It is very stressful just because of the limitations, the restrictions that are placed upon all of us in the hospitals. But as far as hope, we really rely on each other more now than ever to either talk about it, to de-stress with each other, cry about it, because there's a lot of times that with COVID, we are expected to do more and be family, because family cannot be at the bedside. And so it's stressful, it's emotionally and physically draining. But we rely on each other, lean on each other for support. Walk by your emergency departments and see the amount of tents that are out, not just at Community Regional, but hospitals across the valley. You'll find that we don't leave without PPE on or go in without PPE. And it's very real, and it's a very trying time in healthcare, and we're all doing what we can to get through it.
I had had a patient. He was already a trach patient and had an old stroke. We were getting feedback from the family that he was a lot more involved, and we weren't getting that, so we got kind of worried. And one of the things that we're able to do now with communication is use the tablet or the iPads. And when we were able to put the iPad in front of him with his wife on the other end, his face lit up. His eyes became tearful. So tears are going down her face, tears are going down his face, and tears are going down my face. And that's, to me, the importance of being a patient's advocate and doing what we can to get them to communicate with their families.
There have been times, you know, when we face days and they are just so busy that all you have time to do is just keep going, keep going, keep going. But at the end of the day, you look back and you're just so rewarded by what you're able to accomplish during that time. And it took everybody. It took everybody from, you know, the nurses to the ancillary staff, our PCAs, our monitor techs, our house supervisors that are, you know, keeping things moving and flowing. And we get through it. And at the end, we're closer and tighter with each other, just knowing that we've accomplished such a great thing for our patients. I think the thing that gets us through this pandemic or this crisis right now is the fact that we walk shoulder to shoulder with each other. Things are getting busy and we're getting tired. We step in, we help each other out, we encourage each other. That's the huge thing. Those little things make such a huge difference, both in the patients' lives and our lives.
I come here, I come to work. It's my job. It's okay, I signed up for it. I love what I do. But there are people out there that still are not understanding how it's affecting people of all ages. Coming into this business, we know that we have to deal with it, but not at this rate and not at the extent of which we're seeing it. And the fact that, you know, you're having 30-year-olds lose their life. It's heartbreaking, dying alone. That's something that I just, you know, it breaks my heart. It breaks everybody's heart, you know, in healthcare. To have your last conversation be on FaceTime is heartbreaking. And that's the hardest part for me personally. Help us out. You know, we are definitely trying to do our part here day in and day out. And, you know, we are trying to do our very best for our community. So we just ask that our community also helps in that process. So please, you know, do your part, be our heroes, you know, be my hero. I would love that. You know, I'm your healthcare hero, so be my community hero.